Our entire health and social care system is yet again under enormous pressure. We are currently in the peak of a further wave of COVID, and that is greatly impacting on all our services across community and hospital settings. Over the past week, we have seen an increasing rise in the number of cases, followed by growing numbers of patients requiring hospital admission. And today there are 65 patients requiring acute care in our trust hospitals. Overall, compared to previous surges, there are more patients in total in our hospitals than before. This is placing very significant pressure on all our wards, our critical care unit and our emergency departments. As a snapshot, on one day last week, the Ulster Hospital teams were managing over 150 patients in the emergency department, 60 of those patients being cared for on trolleys requiring a hospital bed. On some occasions there have been 15 ambulances waiting outside for several hours to offload very unwell patients. Our ward teams have been working tirelessly to care for high numbers of patients with COVID, and they are being supported by our community teams who are stepping up to maximise patient flow and discharge from hospital. We fully appreciate that you have all given so much and are tired, but in order to get through the next few weeks, we need to ask you once again to step forward and to support our frontline services. Over the next week, we know that admissions will continue to increase. Therefore, we will need to continue to prioritise patient safety, ensuring that those patients most acutely unwell can access the care they need. This will mean that we will need to discharge all patients as soon as it is safe to do so, which we recognise may mean to home or to an available residential facility. This current surge is predicted to peak for hospital admissions by the middle of next week and then quickly tail off. This has been the case in Scotland. Over the past weekend, we had to put out a call for extra staff, and yet again you responded. Thank you all so very much for coming forward and going beyond the call of duty to support your colleagues in these challenging times. Your commitment never goes unnoticed. Some of your colleagues may be COVID positive, and some may be self-isolating at home as a close contact, putting further strain on our workforce. Our most valuable resource is you, our staff, and we will support you in every way we can to get through this period, and we will come through it together as one team.